Thank you everyone for coming. For those of you guys who haven't met me, my name is Janet Vasquez and I'm the advisor and coordinator for the Behavior Analysis Program. And we have many new developments in the program, one of which is the workshop that you're sitting in now. This is the second of the series. And we have several exciting workshops in the planning stages, which you'll hear notification about soon. And I hope that you'll join us for. So without further ado, I know you guys are anxiously waiting for Dr. Azrin's talk. I'm going to ask Dr. Boards, who is the director of the Behavior Analysis Program, who is going to tell you a little bit about Dr. Azrin, who is a dear friend and colleague of his. So, Dr. Boards.
I was going to tell you that this is our lucky day. We have Dr. Azrin giving a talk. Most of you know about his work because if you picked up any behavior analysis textbook and looked in the back, you'll find that he has many, many papers that are cited there. He has worked on, his schooling was at the Boston Latin School initially, and then you said there was some university you attended in the Boston area. Which one was that? Harvard. You forgot Harvard. Oh, Harvard. Yeah. So I guess he says he went to Harvard. But if you've been in behavior analysis as long as I have, you will know that his name is associated with work in the token economy, positive condition suppression, punishment, extinction-induced aggression. You remember those rats? Escape avoidance, etc. Opportunity for aggression. He worked on the Guy de la Tourette syndrome, but he worked on tics. So many of you will remember the study he did in the 1970s, or should I say the family of studies he did, in which he successfully reversed tics. And these were always talked about as based on anxiety and so forth. And he showed how you can manipulate the musculature of these individuals and the tics would go down 1/2 to 2/3 in incidence under the manipulation of the musculature that supported the tic. He also worked on jobs. He was the co-author of 2 books, one on continence in adults, which is by now sold about 5 million copies. It's a Penguin book, as I recall it. He also, with his wife, worked on a variety of other, published another book, in which there were a variety of other problem behaviors which were reversed. And he also has done work on jobs, on how to get people experience to apply for jobs and to get the jobs. So he's touched almost every topic of importance in the history of the field. And next to his teacher, Skinner, you would be hard put to find anybody who's had so much influence in a field. We are fortunate that he lives in the area and has worked for some 30 years at Nova University and has generated very many students at Nova. And luckily, we're in the area. And he has, perhaps for the 6th time, come to speak to us. And apparently, we seem to treat him well enough, so he returns. So I'll have to make a note on that. And there are lots of fascinating stories about Dr. Azrin. For example, at one point in the early 1970s, he was president of 2 major psychological behavior analysis societies. One was the Midwestern Psychological Association, and the other was the Association for Behavior Analysis International. And the these two societies had meetings across the street from one another. So when you get to know him, he'll tell you how fascinating it was to run from one meeting to the other, and back and forth and back and forth. But he has had a hand in very many types of work. He has been involved for years in Southern Illinois, associated with the Anna State Hospital and with the Southern Illinois University, which under his auspices and those of some colleagues, has started a program which exists to this day and which turns out dozens of students every year. Without further ado then, I will introduce to you Nathan Azrin, who will give us a talk which sounds difficult to understand by title, but having experienced talks of his in the past, I can tell you, you won't easily forget some of the points he makes here today. Again, without further ado, Professor Azrin.
Present was more in the order of 6 or 10 than it is today. And I can understand the motivation of many of you in being here, and that is that there are continuing education credits being provided for those of you who are seeking certification as a behavior analyst. And so that in a way there is an ulterior motive in coming here, other than any desire intrinsically, certainly to go and to listen to me, or to hear more about behavior analysis, because you can read about it, you can take courses in it. But the fact that there is an extraneous reason is not to say that it is not worthwhile, that the entire field of reinforcement is in fact deals with having extraneous events motivating you, and that's what we call reinforcement. And recall the fact that I took my first course in psychology solely because I needed a sufficient number of credits as an undergraduate, and the university required that you have a specific number of courses in literature, social sciences, science, and gave you a menu that you could choose from to satisfy that. And I looked at my schedule, and I was busy working my way through college and taking more hours than the university technically allowed each semester. So there was scarcely any place to take an optional course. And there was one course that was allowed, and that was in psychology. And I remember thinking that, why did they put a P at the end of at the beginning of psychology? Why didn't they just say S-Y-C-H? And what a strange thing to do. And so I took this course in psychology, and it ended up dropping the other field that I was majoring in, and that I have continued without interruption for the last, what was that, in 1948? So what does that mean? About 60-something years. And with absolutely no regrets. So the fact that you are coming here to satisfy some extraneous requirement is in no way an indication that what it is that you may carry away with you will be something slight. It may be determining what you do for the rest of your life. In deciding what to talk about, I decided that having given lectures to classes, being an academician for the last 50 years or so, that I would try to personalize it more, and to go into, rather than to give a talk as usually is done in the university, where you give a superficial description of a large number of theories and points of view, Or on the other hand, if you're listening at a convention, that you'll have a graph. I don't have any videos. I am the video. So I didn't have to learn anything about PowerPoint. All I had to do is to go in to find my clip-on tie. You probably never heard of it before. But you don't even have to tie it, right? I'm not going to demonstrate it to you as a novelty. And in the convention, what you do is you have a figure and a table, and you talk about the specific numbers, and you're hoping everybody will look at it and say, wow, and be very impressed. And all that you remember at the end of the talk is how many words they speak of mispronounced at the end of it, or what he wore, or he had his hair on the wrong side of his head. So I wanted to personalize this. I'm going to take a very, very different tack. And that is, rather than be very superficial and try to talk about the global area that I'm in, or to go into be very detailed and talk about the specific area of study that I happen to be working on now that you may be interested in. Because my feeling is you can always read about it. And that the invention of the printing press was a wonderful thing. You can read about it. Right? There were books, and even though they're now digital in form, it's a very efficient way of communication. Instead, what I will do is go and personalize this very much. I'm going to give the talk pretty much as a product of something that was suggested to me a short while ago. I received an invitation from one of the large European universities that they were celebrating the 30th anniversary of the establishment of behavior analysis at their university and its accomplishments, and they invited me to be the keynote speaker because the invitation said, you have invented, developed something like 6 or 7 different procedures that are now validated and in widespread use, and that there's nobody like you, that nobody else has done that. And so flattery will get you everywhere, right? And so the first thing I did when I read it and immediately said, I accept. If they've got such good judgment, then how could I possibly refute it? And so, but then I started thinking about it, and which 6 or 7 are they talking about? And so I started going over the things that I had done, and the list kept growing. And I didn't know which 6 they were talking about. And I ended up with something like 10 or 15, and then I showed it to my wife. She and I worked together. And she said, oh, well, you forgot this. Oh, yeah, that's right, marital counseling. What about job finding? What about stuttering? What about posture control? What about aggression? And, oh, yeah, here, let me add that. And I kept adding it, and I stopped numbering them. But right before the talk, I did number them, and it came to roughly something like 25 or 30 things that I had published on that were new, that were different, that were either treatment procedures that didn't exist before, or new general procedures that encompassed a number of different treatments that hadn't been developed before. So which one should I talk about? And I said, well, I'll choose those that are likely to be of the greatest interest. And I tried thinking, well, I'll talk about these 3 or these 4. I said, but then that's only part of the whole story. And so I decided to take a very, very different tack, and that is talk about all of them. And the fact that we got such a late start, it presents a little bit of a problem, but I'll try to talk fast and hopefully talk more about the central features of them rather than superficially in order to get over them. What I will do is I will go first talk, since the title of this is behavior analysis, I'll give just a few words about what behavior analysis is in a broad conceptual point of view, but then jump right into the question of what is it that's different? What has it developed? What has behavioral analysis brought to the universe, to people's comfort and to the development that didn't exist before? And I'm going to approach it in a somewhat different way. That is, not talk about what the literature says. I'm not going to say anything about what other people have developed. I'm only going to talk about what I have developed. That's all. Right? You came here to hear me, so I'm going to talk about my favorite topic, me. And then what is it that I developed? And as I go through the different problem areas, what I will just try to describe, and I may perhaps at times be short shrift on some of them, is what was the state of knowledge about that area when I came in, when I just came onto it? Secondly, how did one now look at this area very differently from the way it was currently being viewed? How is it viewed from the point of behavior analysis? And then quite idiosyncratically, what did I do? What accident or otherwise did I do to get started in that area? Why did I get involved in studying things like nail biting, potty training, job finding, marital counseling, debt pulling? What was my absurd interest in that? Was I born with an interest in finding out why people pull their hair or bite their nails? Or did I have such a bad marriage that I felt I had to study about marital counseling as to how to improve it? So I'm going to go into the specifics. And some of that is humorous, and some of it is accidental, and to anticipate, almost all of it was accidental. That I just happened to for some kind of extraneous, completely incidental event. And in doing that, just talk about how that approach now reflected some principles of views, specifically of behavior analysis. And lastly, what has been the impact? And on some of it, the impact has been very extensive, so that it's almost universal, that you'll be surprised to hear that when I tell you that I developed it, you'll be surprised to hear that I was a developer. You thought it was just God-given, that was always there. And others, somehow the rest of the world hasn't realized the impact of what I found, and have not yet, with the word yet being in there deliberately, have not yet adopted it, and that is, I still remain hopeful. But the ultimate objective is to go to do good. Well, to get very personal about it, Jack already mentioned that I went to this Latin school, which specialized in studying irrelevancies, on how to speak Latin, how to read Latin, how to go. Its modern history class only went up to, I think, the American Revolution. It didn't go any further than that. And then I went to Harvard. Going to Harvard was, the reasons for doing that were not because that I went to Harvard and I happened to meet this well-known psychologist named Skinner, and it happened the other way around. And that is that I was in another doctoral program. I was involved in this field of personality and social was the name of the program, and studied about Freud and about Carl Rogers and about all the social psychologists and Kurt Lewin and others, and went past all the exams and all the courses in it, and I was starting to work on my dissertation. I passed the general exam in child psychology, and I was about to do my dissertation, and a terrible feeling came over me. What am I doing here? I'm a fraud. I get a degree, and people are going to call me doctor and professor, and I'm going to give lectures and write articles quoting esoteric authors all the way back to Aristotle and Sophocles, and showing my scholarship. And what am I going to tell them if I'm teaching a course in child psychology? What am I going to tell them about how they should treat their children? What is it that will make them better behave, will make them better citizens, will make them happy? I know nothing. And nothing that existed in the field at that time was there. So as I put it, I'm all dressed up and know where to go. It's a terrible feeling, right? Through all those years of school and work and expense, and feel that it really doesn't count for anything. I'm just be-mouthing things that people have somehow, for some foolish reason, have paid to hear, but doesn't in any way improve their life. So, but I came across a particular book that talked about this new field of about it wasn't by Skinner, it was about operant conditioning. And the emphasis there was on observables, not about theories, not about speculations, not about whether you were a Freudian or an Adlerian or a Jungian or an Adlerian. I mean, they talked about facts. And there's a book that was written called Theories of Learning that was very nice. But what were the facts of learning? Let's say a word about it. That's what counts. What are the facts? If you're going to teach, what are the facts of learning? Not which learning theory is better. And So I read that book, and that was a turnaround for me, and that was back in the early 50s, so that was about 60 years ago. And I said, well, the person that they wrote about in that book was Skinner, and so I wanted to study with Skinner. Where is he, Skinner? He's across the river. I'm a native Bostonian. He's across the Charles River at Harvard, and so I applied to Harvard because that's where Skinner was. If he was anywhere else, I would have done that. And then I spent the 2-3 years at Harvard doing animal psychology. I wanted to learn to really you're dealing with the observable, you're dealing with facts, you're dealing with things that you can count, that you can measure, that you can quantify, that you can see, and not all this vague talk that existed in psychology at the time. And so that's what I did. At that time, Skinner was no better than anyone else in terms of applied psychology. He did nothing in applied psychology. All of his work was conceptual and very, very large impact as seen by his influence on people like myself. But didn't do anything in terms of anything that was applied. And that was true not only of Skinner. If you looked at all of the other well-known learning theorists, Pavlov, Pavlov didn't do anything, didn't develop any treatments based on Pavlovian theory. Skinner didn't do anything developed on Skinnerian theory. And so that was a wide open thing. And my objective since then, that's guided all of my work, and that of behavior analysis, is to apply these things, to forget the concepts, forget the arguing about theories, forget about being a behavior therapist or a behaviorist or a family therapist or an analyst. The important thing is, what have you developed? And if you looked at the field in terms of what the state of knowledge was in terms of the applied end of psychology, you had, as I mentioned, people like Freud and Karen Horney and Adler and Jung and Sullivan, where he talked about relationships. There wasn't anything that was found in. There was no treatment procedure. The treatment procedure was you talked 3 times a week, preferably at $200 an hour for 3 years, at which point you could be certified, which is no small thing, because now you could now have people come in 3 times a week for 7 years at $200 an hour. So the economic objective, it looked as if that may have been clouding, but several people in the field, Eysenck, a fellow named Eysenck in England, wrote an article that had a big influence on others, and he said that the emperor has no clothes, that all of these therapies that people are arguing about, none of them have any evidence that they are effective. And by evidence, don't mean it's a study that's cross-sectional with equal numbers of men and women and young and old and different religions and different skin color and from different parts of the country. Didn't even have a single controlled study, not even a single subject, right? And so it's really looking at the question of the validity of evidence with a mother's eye. And as you accept anything, there is nothing. And that's the field of clinical, that's the state of knowledge, right? And then in the field of experimental psychology, you have conflicts between the Pavlovians, the people Pavlov, and the Skinnerian. And an experimental psych, it emphasize sensation and perception and nonsense syllables and reaction time and latency and all. And what's that got to do with the real life? Nothing. The thing we read may be nonsense, but we're not explicit about it. We don't call it a nonsense syllable. Right? And the reaction time, who cares how fast you react, as long as it's on a green light, right? Who cares about the reaction time? Well, so here I graduated then from Harvard, and one of the reasons for going there, again, was an extraneous reason. Why did I go there? Decided with Skinner. I looked at how many years they required to graduate, and it was fantastic. They didn't require 5 or 6 or 7, which was standard for a PhD. They required, the catalog said, only 2. Well, apparently the professors and the people who let you get through these programs, they hadn't read the catalog, because they didn't know that. And so I set my sights on getting through in 2 years. I only came there to study with Skinner. I wasn't interested in taking any of the other courses. And at the end of 2 years, I started my dissertation in my first year, and at the end of the second year, I was ready to leave, and unfortunately, the dissertation chairman, wasn't Skinner, gave me a very difficult time and kept insisting on revisions, and I could never understand why he kept insisting on revisions, but primarily because he was concerned with the grammar. And then I realized, somebody told me later, that nobody had ever gotten their PhD from Harvard in 2 years except that one professor who was my chairman. He wasn't going to have me beat his record. And so, I finally did get through, not because of any particular wisdom, but because the calendar clicked on and I passed the 2 years. And so I had my degree. Now the question, and my single-minded objective after leaving was, how to apply this? How do you apply this to humans? How do you apply it to practical problems? And so, look, what are some of the basic principles that exist, and I don't want to bore you by listening to these things in terms of what is it that behavior analysis has that's in some way distinctive. And one of them is that it wants objective measures, it wants quantification, it wants validation, it wants experiments to be done and not correlations and not theories. And it wants you to not to do studies to going to prove something. It wants you to do studies that will find out what nature shows is true, and that is the subject is always right. Or to put it in practical terms, the patient is always right. And if they're not cured, it's not the patient's fault because he's unmotivated. It's you. You didn't have the right therapy. So that's one of the rules that's carried through from the animal work. The rat is always right. The patient, that's doing lab work, and the patient is always right. Well, and there are other methodologies that go with it, like the single subject design and the ABA design. And there are certain generalizations that are schedules of reinforcement, and the immediacy of reinforcement, and escape versus condition suppression, and all that. But I don't want to bore you with that. You'll get all that from your textbook. But we'll cover those things as we go along and look at the different problem areas. So, what to do? Well, let me start off with the first area. I made an outline, but I can't remember all the areas. I said there are 25 or 30 areas, and I can't remember them all, which is fantastic. It sounds like an awful lot, but if there are 25 or 30 areas, and I've had my degree for 60 years, that's only one every 2 years. That doesn't sound so good, right? What did you do the rest of the time? So here, let me start off with the very first one that I have on the list here. And that is, and I actually brought a timer with me here. But the first one is that of timeout. And I always thought that timeout was something somebody else developed. And then somehow I was reading an article, and they said, and Azrin, he developed all these things, and not the least of which is timeout. I didn't know that. So, when all else fails, look at the literature. So I looked at the dates of publication of the person who was customarily associated with the discovery of timeout. And then I looked at my Vita, my list of publications, and what do you know? I had published 2 articles on using timeout as response contingent. I'll get into that in a moment. And one of them was in this magazine called Science, which is the prestige magazine in this country, where people who get Nobel Prizes get that, and the reason I published there is because there was no behavioral journal. So I went and submitted it to that journal, and incredibly they accepted it. And then the next article was when there was a behavioral journal, and I published the use of timeout with mental hospital patients, right? No longer with animals, mental hospital patients. Okay, what is the situation regarding timeout? And the general feeling, the general state of the field was, timeout is what you do in football. You need a break, you declare a timeout. If you look at it conceptually from psychology, the closest thing to that is the difference between massed and spaced learning. Stated colloquially, that's the difference when you're studying between pulling an all-nighter or studying right before the exam as opposed to studying each night, through each night. That's spaced learning. Mass learning, you do it right before the exam, and one way of looking at it from the point of view of timeout is when spaced learning, what you're doing is you're putting timeouts in there. And the evidence showed in the studies that have been done very nicely with nonsense syllables, that spaced learning was better, timeout was beneficial, that you just drop it in. So that was the state of knowledge regarding timeout. It was considered a passive event that allowed you to recuperate, to go to get renewed strength from an arduous task. How did I get started studying that? Well, I took that from the laboratory, and as timeout was being used in the laboratory. And in the same way, it was just dropped in, that you had an animal responding on a variable interval schedule of reinforcement. You had an even rate of response, a lever press or keep hacking, or chain pulling with the monkey, and then you had a period of timeout. And then usually that was done with having a period of darkness. They couldn't respond. They had a break. And now when they came back, what happened? They responded at a higher rate. Slightly higher. It wasn't that big difference, but it was higher. So the timeout is when it's non-contingent on response. That is when you just drop it in. It's just determined by the clock. Then it has this rejuvenating effect, enhancing effect. And there, my thinking was purely conceptual. What happens if you make it response contingent, like reinforces a response contingent, aversive stimuli a response contingent? What happens if it's response contingent? That you get this rest period, this break, not rest period, because that assumes that the effect is that of resting. Suppose that it's response contingent. And specifically, I had already done my dissertation, not digressing, I had done my dissertation when I was at Harvard on punishment. And why punishment? And that's another example. I won't go into what I found there because that's not an applied procedure. But again, the state of knowledge regarding punishment was very clear. You're against it. In fact, there are laws against it. Child abuse, spouse abuse, robbery, if you're against capital punishment, that punishment is something that's looked askance in every psychology, and every psychologist is against it, that you should use other methods. And why? Because the evidence shows clearly that punishment, number one, is not effective, it doesn't last, so it's not permanent. It just teaches you what not to do. It doesn't teach you what to do. It teaches you to hate the person that delivered it. And last but not least, it causes discomfort and pain to the person that it impinges on. So that was the common belief. And yet I studied punishment. And that's the field, and that reflects the field of behavioral modification. You don't let common beliefs dictate what you do. You look at it with a fresh eye. And I looked at it with a fresh eye and said, well, we know a good deal about positive reinforcement being contingent. You can have reinforcement contingent on responses on a fixed ratio, fixed interval schedule, DRO, DRL. But what about punishment? And what is the state of knowledge? And where is the data on that? And you read the data, and they weren't. They were just speeches. They were sermons against using it. But there wasn't hard data that said that it wasn't effective, didn't last, or that it generalized to the person who delivered it. And so what I did is I did some experimental studies with animals on that, and did it on my own in Skinner's lab. But that was a very carefree environment then. You didn't have to get permission to do a study then. You just did it. It was sink or swim, and then you presented it, and you either get your PhD, you didn't get it. Anyway, I presented the curves to Skinner and said, here, this is what I plan on doing for my dissertation, and I expected him to be aghast, because he had written extensively against the use of punishment, that positive reinforcement was the road of truth and welfare for all of society. And here, somebody in his own lab is doing this very extensive study on punishment and finding out that it works, and it is immediate, and it is better than anything else, and it does last, and it doesn't generalize and just teach you what not to do. And his reaction was as gratifying as it was positive. And he said, fantastic. That's wonderful. I couldn't believe it. But that was the spirit of behavioral psychology. It doesn't make any difference whether it agrees with common beliefs or accords with anybody's theory or anybody's religion, or if any you have to reconcile it with the literature. That's the fact. Well, so back to timeout, okay? And then what's the continuity here? I'm not digressing. The reason for going to timeout was, how can you have a response consequence like punishment that's contingent on inappropriate behavior, on symptoms, that's not going to cause personal discomfort, right? If it's physical punishment, it does. Electric shock with animals, or a spanking, or hitting somebody, or a blow. That causes discomfort in addition to whatever other effects. But is there any kind of response contingent event that doesn't cause you that great discomfort and still will have that same marvelous effect of being very effective, immediate, long-lasting, and be in the person's best interest? Time out. And that's why I developed the time out. I was looking for something that would have those characteristics. So I published that in as I say, in this magazine Science. I published it in this other journal. And time out now, not only people that are citing the wrong person who invented it, even the person who did invent it didn't know it. Right? I didn't know it. But it just followed, the logic followed from behavior analysis. And that is, you don't pay attention to common beliefs, and you look at what do the facts show. So that's the first article that I had here. Where was it? Time out? Yeah. And so now, what have I got left here? Now we're going to talk about time in. Right? Talk about time out. I've got 25 topics to cover. Right? We're going to quit at 3 o'clock. It's now 1:50. So it's 60 and 10 is 70 minutes. I have 25 minutes roughly in round figures to cover in 70 minutes. 70 divided by 25 is roughly 3 minutes each. I have a time-in apparatus with me. And this is something picked up at Radio Shack. And I punch in here, it says minutes, 1, 2, 3. And then I hit start. I have 3 minutes to talk about the next topic. And then you'll hear a chime.
He's reinforcing it.
So the next one now is that of retardation. And this is something I think most of you are interested in because you're in behavior analysis, and now there's really a great demand and funding for working with retarded and certainly with autistic children. So first, what was the state of knowledge? It was run by the people in the field of education. That's 30 seconds. I got 2.5 minutes left. It was run by people in the field of education, and you had the people who were educable, that is, who were close to normal IQ, and then those who were non-educable, that is, you couldn't teach them in a class. You had people who were trainable, that means one-to-one, you could have some effect, and then you had the untrainables. Untrainable. So what was my objective? Train the untrainables, the impossible. The people that are considered to be impossible to train. You can't do it in class, you can't do it one-on-one. It's in another field. These are people who just put aside in institutions with large numbers and just cared for their needs. They didn't have cutlery because you're afraid to give them a knife or a fork. They might stab themselves. They often had aggression. And the people who are in this lower level, that's an IQ of less than 20, the people who are called alternatively profoundly retarded if you're a psychologist, or the untrainable if you're an educator, or if you're a tester, less than 20 IQ, they couldn't talk. So you couldn't just offer them sympathy. You couldn't talk about their problems and their history and why are you doing this, why are you not paying attention. They couldn't talk. Not only couldn't they talk, that is, no expressive language, but they didn't have any receptive language. They couldn't understand you. Could you go and say please? They couldn't understand you. You could say up. No, they couldn't understand you. So they couldn't understand, they couldn't talk. Not only that, but they usually had massive physical disabilities, either blind or deaf or paralyzed or spasticity. How do you train them? Right? And how did I happen to do that? Well, I was in a hospital for the mentally ill, and they had discharged many of the people who were mentally ill into community facilities, and they took in instead retarded people. And here they were, retarded. What do you do with them? They couldn't dress themselves. They couldn't eat with any utensils. They couldn't toilet themselves. They couldn't do anything. They were laying on the floor. There was nothing. Train the untrainable. And so what set out to train the untrainable. And how do you do that? Well, it wasn't that big jump from the animals to the profoundly retarded. The animals couldn't talk either. And they didn't have receptive language either. But there are these marvelous procedures that we modified. We use prompting, shaping, we use reinforcement, not one reinforcement, multiple reinforcement, remember facts of learning. So we made a list of groups at the end of it. Yeah. So, And now those procedures are standard. I used up my 3 minutes. Those procedures are standard. They're everywhere. In fact, my own daughter, who's in the audience now, she works with the developmentally disabled, with the retarded, the autism. And those are the procedures she used. And she kept telling the people, she tells me in work, says, you know my father developed those procedures you're using? You better do it or he can kill us. They don't know. But I don't care about being cited. It's just the impact. Here was had an impact on hundreds of thousands of people. The untrainable now are trainable. They can dress themselves, and toilet themselves, and they can do everything by themselves. And the whole field of behavior analysis and retardation, that many of you are in now, are based on it. Okay, number 2, parent-child disorders. It was 3 minutes and 96. No, why is it 3 minutes? That's wrong. It should be 3 minutes. Here, training, and then parent-child disorders, and that is in psychology. They have these DSM diagnosis categories, and they're ODD, oppositional defiance disorder, conduct disorder, hyperactivity, and all of these different things. Now, misbehaving. These are children who are misbehaving and they're tyrannizing their parents. And so you do this, how do you do that? Is it because I had trouble with my children? No, they were angels. I can't believe that they grew up to be normal in spite of me. But I didn't do it because of that. What was the state of knowledge? Well, it was the one I mentioned. Here I got getting a PhD in child psychology, and I couldn't say anything about how you train people and how you treat children. And so that was the rule then. I said, here, I want this to be applied to children, going back to the reason, my old interest, child psychology. What can I do to make children happier and more functional, and parents proud of them and proud of themselves? And so developing these procedures, now it's called positive parenting. They have a name for it now. And then using positive reinforcement. And if you have to use a negative consequence, what is it going to be? Time out, right? And just as we said, and we'll be seeing that there are other procedures besides time out that I developed that are along the same line. But so this whole field now, positive parenting, and then a recent survey that was done of child psychiatrists and child psychologists about what was the theoretical orientation that they follow more completely than others? Behavioral. It's not a rule, right? You have to look at references, how many cited. Do they know that you did it or not? There's no difference. Those did studies on parents' youth, and they developed parent skills, youth happiness skills, parents' happiness skills, and programs for dealing with them. And what you will be talking about more, the token economy, when all else fails, token economy. Job club, employment. What are the big problems in the world? Jobs. What was it? 12% unemployment in Florida, 10% nationally. I mean, they're all. It's just. What is more important than having a job? What is the state of knowledge in the field? Well, I was in a department called the Rehabilitation Institute. They had 3 tracks, and one of them was called vocational counseling. And so I was privy to experts' opinion. What are the procedures that are available? And blah, nothing. Nothing. Why did I get involved in this? Well, I had finished with the token economy. I'll be talking about that with mental hospital patients. They were all active. They were doing things for themselves. They were doing things for each other. Now, put them out, my feeling was now have them now do the ultimate in terms of independence, and that is earn their own living, not having this being supported by the state and an institution. Well, get them a job, have them work. And I did a nice conceptual analysis, just the way everybody said you should do a conceptual analysis of it, and that is what is the reinforcer? Why do people hire people? It's because they can do a better job at helping them to make money. And what do you do? So what do you do to get hired? You obtain the experience or the credentials in that area, and then people will hire you. So I went ahead and did all of the right things, looked at the newspapers to see what jobs were being added to, what jobs were being looked at, when people looked for positions where they were looking for positions to be filled, and especially those that had experience needed, and then decided on that, and then actually built my own training workshop. I hired somebody who had worked as in that industry and had him do the training, bought the materials, bought the equipment, and had them actually obtain the experience. in this workshop. And then had them go out and look for the job, and nothing. Couldn't get a job. They couldn't get a job, and yet they were more experienced, and yet something's wrong. But again, remember, the rat is always right, the patient is always right. It's you that's at fault. You didn't do the right thing. So, when all else fails, look at the literature. It's just the opposite of what academia tells you. Before you start a study, read the literature. I never did that. Never. And the rationale is that if there still is a problem in society in that, then it's obviously not a cure, and the literature obviously doesn't dictate it. So forget it. And people are going unemployed, and retarded people are suffering in a vegetative state. So there's nothing in the literature. Well, nothing in the literature about state ex-hospital and mental hospital employees being hired. Well, then look at the next best thing. What about nobles? Nothing in the literature there either. Isn't that horrible? And yet, people are obtaining degrees in vocational counseling, books are being written in vocational counseling, there are journals of vocational counseling and rehab. And we talked to the people in the rehab institute there, and they mentioned things they were doing, and they talked about the general approaches, where was the evidence, where were the studies. There weren't any. And so there again, you'll see it again and again. The veneer of knowledge is just thin deep. That no matter what you study, just if it's a problem, work on it. I'm trying to think of what to do for a dissertation. Oh my, what this thing is doing? So here, timed up. So here, I'm going to have to just go one more time on this last one. So I developed a procedure on that. And briefly, I gave a questionnaire to the people that were in the graduate students, and your last job that you had, how did you obtain it? And of course, they said because they were a genius, they were bright, they were exactly what the employer was looking for. And of course, that was nonsense. So we backtracked and said, how did you first hear about that job? What made you apply for it? And then a startling generalization came out, and that is that it was very personal. It had nothing to do with the training, nothing to do with experience. And then I looked at the literature, that was the next step, and sure enough, sociologists had done extensive research on it, and in a nutshell, they found that 2/3 of all jobs in almost every field, professional in other words, are people first even applied for it because of the information and advice given to them by a friend, a relative, or an acquaintance. That's the average number of interviews, 2. That's all. The real critical thing is finding out where it is to apply. Well, so I built this procedure. What does the procedure consist of? Again, I'm being very superficial at this point. I called it the job club, not because it was a club. It wasn't designed to entertain. It was designed to get you employed. But they met as a group. There were about 12 people or so in the group, and you had them not a rah-rah kind of thing. You're great, you're wonderful, this is where you should apply, this is what you... They applied right then and there. Everybody had their own phone, they had a fax machine, we had a secretary that typed up their resume, and they were busy calling up and making appointments. We kept a log of it, we showed them how to do that, and we wrote a book on it that had all the forms on it, and what was the rate? The success rate on that, the normal population was 93% of them obtained jobs within 6 months. I ran a control group on it, and that is people who looked for a job on their own. Well, they went want ads and sent out resumes and went to their vocational counselors. There was about 20%. 20% versus 93%. In other words, you want a job, you want a job, though. Virtually everybody. Am I not close enough? Am I not speaking in the lift-less tones? Do you want me to water my well, so there, and there's nothing more, and just the nutshell of it, there are many countries that have this, the first thing the federal government did is made it mandatory in their welfare program where they encourage people to get jobs as a prerequisite to giving them welfare. They made it mandatory. But they said not only the job, but it could be any kind of group requirement program. There are some countries that have it mandatory. When we were in Australia, signed everywhere. Unemployed, join the job club. In England, join the job club. In Australia, We're in Scandinavia, that's mandatory. So it's very, very widespread. Big question, why don't they all use it now? That's a question that Vicky was just saying the other day. This severe unemployment. Why is it that the government doesn't mandate the job fair? Why doesn't it make it for everyone? And that is the only glib, speculative answer I can give to that is that there are some answers, like the ones with retardation or in the field of education or in psychology, where truth does not matter. That people have a conviction of what's wrong, right? Anybody's on their own to be able to find a job on their own. That's the American way, that's the capitalistic way. I don't know why. Anyhow, there it is. All of these people were able to go to find a job. Okay, parent, child, job from Maryland. That's the next one. Here we go. Reset. Okay. Maryland. If you have to talk about universal, what are the really universal things? Marriage. What is it? Something like 95% of the population gets married. 99% of them are working, or they are living off somebody else who isn't working. And so it's the worldwide token economy is what it is. And so how do you, and so, so we talked about the part on the job, but the other part, marriage. People you get married, and even those who get divorced, something like 50–60% of them get remarried again. It's a very, very robust institution. You say, well, it's not so robust, 50% of them get divorced. That's not bad. Do 50% of your children stay loyal to you? Do you keep a job for 50%? Do you live in the same house for 50%? And when you look at the actual statistics on that, and look at how much percentage of married people get divorced every year, it's between 1 and 2%. That's all it is. 1 and 2%. It's a very robust institution. And say, well, then how do you get 50% of them, half of the people getting divorced? Well, if you're married for 30 years, right, 30 times 1.5% is 50%, right? So it's a very robust thing. Okay, how do you look at it? Well, again, how did I get interested in it? Well, I got interested in it because I read an article by a fellow named Dick Stewart, who was actually a sociologist, that he got involved in behavioral psychology. He wrote an article on it. The procedure he developed it was a terrible procedure. I mean, he applied even rather negative terms, demeaning terms to the procedure itself. So the procedures he developed, it wasn't there. But what he did is he quantified it. How much did they talk to each other? What increased the communication between them? What was the frequency of sex that they had? And so there were some hard measures. And so it was quantified, it was specified what the dependent variables were. Well, so that immediately said, well, that's the area. I'm going for that. And I'm going to do but here, let me take a look and see what other articles that have been done. Because here was one that had been done. It wasn't a complete vacuum. And is it 47 seconds? And nothing in the literature, not a single study, not even of a single couple, nothing with quantification, and yet people got degrees in marital family therapy, there were books on marital family, on marital counseling, your grandmother and your mother-in-law, they certainly had all of the answers on what would constitute a happy marriage, but there was nothing there. What was the general approach that I took on that? Well, looking at it from a reinforcement point of view. Why do people get married? Because they have more reinforcers, but reinforcers would be available to them in marriage that are not in the single state. What are those reinforcers? I made a list of them. And the obvious one was sex, communication, social relationship, children, vocational assistance. This person will help you with that. I made a list of them, 12 of them. And it turns out that there are many studies that have been done. And again, look at the literature, but after I made the decision to work on it. And shush, I'm finished. This is time in. The time in is over. This is my time out now. And so, increase the frequency of reinforcement. And so, increase the frequency of sexual behavior, praise. Made up lists. How many praise statements? How many compliments did you give each day? And they had them keep a list of that and count the number of compliments, how much you gave each day. The fact that you thought it is relevant. Yeah, I love her. She loves me. That doesn't count. Have you told her that? More importantly, not love her. What real behaviors have you done? Because give a compliment, you tell them you're bright, you're pretty, that's nice, you have a nice dress, doesn't help you at all. But you go and you tell them, you listen to my troubles, you help me with the children, you help to prepare the meals, you give me. You run errands for me. Now you're reinforcing. It's response contingent. That's the difference between an appreciation and a compliment. So it's looking at it altogether different. It's bring a reinforcement perspective to there, and now you could count the number of reinforcers that they were giving to each other. You could objectify them. And did the studies on that with the control groups where they just discussion type counseling, supportive counseling. That's what people usually do have a master's degree. And the number and the marital happiness ratings. Imagine behaviorists talking about marital happiness. I actually developed a scale called a marital happiness scale. But you quantified it. 100%, 50%. In other words, you deal with the subjective dimension, but quantify it so that you're dealing with something tangible. And that's become common in the field of medicine. They say, what is your pain index? 100%, 0, 10. So the fact, this conception is that behaviors only deal with the outward behavior and not with the mental pattern. They not only deal with it, we do it with the courtesy and the dignity of quantifying it, of focusing on it, of measuring it, of having our treatment depend on it. Well, so that's now common now. The people in the General Marital and Family Therapy Society that they have, and one of the first presidents of that society was Dick Stewart, the fellow who developed this thing. And then this other fellow who is one of the behavioral people working on that, on marital counseling. And so it's now in widespread use. If you go into any marital thing, what they'll talk about is the frequency of reinforcement of compliments, of appreciation, contracting. You do for me and I'll do for you, which is a reciprocal reinforcement. Okay, now depression is the next one. Bingo. Stop. Okay. There, we're in the time-in phase now. The time-out has ended. Depression. Those of you who are psychologists know what the dominant view is of depression, the treatment. Cognitive behavior therapy, Beck. What you do is you find out what the person's schema are, that they went through life with negative conceptual schemas, and you're going to reverse that. And so you do a cognitive restructuring, have them think differently. How did I get interested in that? Well, my interest in that happened really from a conceptual point of view. I was teaching courses, and I was teaching about depression and anxiety and all the rest of it. And if you're teaching a course, you have to teach what other people think. And I said, no, that's ridiculous. People are depressed. Why are they depressed? They classify depression customarily in psychology as reactive depression and endogenous depression. Reactive depression is you're depressed in your reaction to something happened. Endogenous, it just happened. You don't know why. And it almost seems like it's physical, but you can't identify it. And if you look at the current state of what causes depression to individuals, it's very understandable, and that is they lost their homes, they're foreclosed, they lost their job. The current, the entire economy and the individual's state is very, very negative. They're depressed. Looking at it from a behavioral point of view, I said, well, how would I approach that? Reactive depression, there's a reinforcer there. They had a happy marriage that broke up. They had a loved one, a son or something, died. They had a beautiful home, lost it. They had a beautiful job, lost it. It was the loss of a reinforcer. What's the remedy for that? Doesn't take a brain surgeon to figure out what to replace it. Well, you can't replace the child that died, but the loved one that left you, you can find some other one. You can find other friends, other people whose source of affection. If you have a family, or one of these, even in the case of a child that died, you can now give more affection to the people, to the children that are left. If you lost your job, find another one. Join the job club. If it was your marriage that caused the problem, there are a solution. Behavioral marital counseling. Look for what the source of it was. Instead of say thinking, which is ridiculous. If we had more time, 18 seconds. There's a cute anecdote I can tell you about that, about a program that called itself a job club, and there were people who were unemployed. And I was attending it as an invited guest, and so I asked at the end, I was just almost a straight man, I asked the question, how many of the people succeeded in obtaining a job as a result of your program? And the person who had done the study and presenting said, well, none. I go, well, and why are you doing it? And the head of the program said, well, because Reagan, who was president, said he wanted a job finding program in all of these one-company towns where you had massive unemployment. And so, and the AFL and the CIO, they all endorsed it. And the the Republican Party and the Democratic Party endorsed it. And the Party of National Association of Manufacturers and all of the small business owners associations endorsed it. And there was the people cognitively, they said they were happy. They are happy. I don't know why. Maybe they gave unemployment benefits, so they gave them some kind of toys to play with. But here they were unemployed. Their families were suffering. Society was suffering. To me, that was cognitive therapy carried to its extreme, where you're only interested in whether they're happy. You want them to be happy, productive citizens. That's the behavioral point of view. And that's the way that I looked at it. The important thing is to get them jobs. Well, and so get rid of the depression. You get rid of the source of the depression. So it's a whole different kind of approach. And the way you do it, you look at what the cause of the depression was, try to replace that, and since the symptoms of the depression is that the individual is losing any interest in all the positive things in life, you have them make a list of the things that they still have fun doing, have them schedule that so that it fills up their entire day, and it's cognitive because it's hard for you to do enjoyable things without thinking enjoyable thoughts. Right? So are we ignoring thoughts? No, except we are interested in people functioning in society as well. And you can't have enjoyable functioning without having enjoyable thoughts. Okay, forgive me here, I've got to start the next one here. Alcoholism. Alcoholism, we know what the current state, we know it's a terrible disorder. It used to be considered to be a criminal offense and they put it in jail. And then I remember the state hospital I worked in, they thought that they were being progressive. They started as well, it's not a criminal offense, it's an illness, and so we had a special treatment program. I did, had a special treatment program, it's an illness. And so that was considered to be progress, and now it's considered to be something that people openly will say that they're an ex-alcoholic. What is the current state of affairs about treating it? AA. There's an AA in every corner, right? They have a chiropractor, they have a bank who will lend you usurious money at usurious rates. And they're everywhere. What is the evidence of effectiveness? That was it. None. When I came to Florida, I approached the local Goodwill Society and said I wanted to start a program for alcoholics. They had a program for alcoholics, behavioral. And I told them what the program would be like. I said, well, no, we can't ask them their names. Remember, it's Alcoholics Anonymous. Anonymous. That's the one thing definite, is that you don't say what you do, they say what you don't do. You don't ask them their name. And so couldn't run the program, there's no way you could get data on them. And he says, for example, Jack Adams said he wouldn't stand for you asking his name. I said, don't you realize you just said it? And then he came. So that was the state of knowledge. There was nothing there. It's almost like the other area. And yet, as a behaviorist, well, how do I work at it? And so conceptually started to figure out, how do I work on it? And it was because there was an alcoholic unit in the hospital, and so I felt that I ought to really try to develop something on that as an alternative to them. Because when I talked to them, they talk about 12 steps. I didn't know what that meant, 12 steps and then jump off a cliff. I didn't know what that meant. There was nothing there. They said they didn't believe in God, but half of the people in the hospital were atheists, and so they wouldn't have any part of it. So what you do? Well, so I took a behavioral analysis of it. There's a case where there was an accident I started on it. There was an alcohol unit there, not that I was an alcoholic or anybody in my family was an alcoholic, so I decided to study it. So looking at it from a behavior analytic reinforcement point of view, why do people drink? What are the reinforcers? Well, very clearly, we have manufacturers who go out of their way to make exotic, tasteful drinks. And so you go and Jack Daniels is my favorite bourbon. They make all these delicious wines that you have, red wines, white wines, flavored wine. And so it's very clear. You have other sources of reinforcement, and that is their social support. There are many occasions in which you have to drink. There's a cocktail party, you have to drink. It's called a cocktail party. You go fishing, you go watch a football game, you have to order a Budweiser. So there's social support. Okay, I hear you. I don't know whether you really heard it, but I had to hit the stop button. And so there are all of these reinforcers. There's a flavor, there's got social support from other people. Most people drinking is a prerequisite for engaging in many of the activities. So the answer is not why do people become alcoholic. That's the question, why doesn't everybody? You have nothing to lose. It's good. You can't enter many sexual situations. Most of your friends are drinking. And so, well then what are the things that act against it? And number one, if you come to work with alcohol in your breath, you will be fired. Number two, if you drink heavily, you will lose your sexual desire. And I've worked with alcoholics, and after you work with them, the woman often said, I don't want to tell you this earlier, but we haven't had sex for the last 15 years. The myth is, again, we're back to the thing about punishment, the myth is that alcohol, right, they have a phrase in psychoanalysis that the superego is alcohol soluble. And that is your conscience will disappear if you have any alcohol. And that's wrong. It's the other way around. You drink alcohol and it cuts out your sexual desire. So you lose your job, you lose one of the primary reinforcers that you obtain from your marriage. You probably have sold your house, right? You come home from an alcoholic binge, and either the police brought you home, so you'll be arrested, so you're more likely to involve yourself in extra-legal activity. You're likely to make very unwise decisions, and so your wife or your non-alcoholic partner asks you, well, have you sold the house yet? Because you're likely to sign everything away. In other words, so there are these terrible consequences. They're legal, they're vocational, they're marital, they're social. Your children are ashamed to say that you're their parent. Your friends have all abandoned you. You borrowed money from all of them and you can't pay it back. And the jargon of the language, you've hit bottom. Or you have become, in this is a rural area, you're living out in the woods. You're living under a tree, not even under a bridge. And if you're in the city, then you're living in the gutter. They find you lying in the gutter drunk. So that's the state of affairs. That's the way psychologists look at it. As a psychologist, that's how I looked at it. As a psychologist, a behavior analyst, looking at it all together different. Solution, maximize the events that will be incompatible with it. Do a stimulus control. We ask, where do you drink, who do you drink, what days of the week? Who do you drink with, and find out who are the non-alcoholic people that you have associated with it are. And who are those that are your drinking partners. And so it would calculate the number of hours you spend each day for each. And the object is to go in to make the amount of time you spend with a non-alcoholic partner go up to 100%, and the amount the others go down to 0%. In terms of, so that's stimulus control is the phrase. You're under control of the situation, the stimulus. The others are going to increase the reinforcement. And so obviously, suddenly the marital counseling becomes a therapy for alcoholism. In other words, if you have a significant other, if you have a loved one, someone who is going to suffer if you become an alcoholic, then that's good. So what we did is couples counseling, try to improve the relationship with their friends, with their heterosexual or homosexual partners, or they're married. Increase it, get them a job that is not part-time, because then you'll drink when you're off, not temporary, because then you'll drink when it ends, but things that are enduring and that are full-time. So how do you do that? Job club. You see how everything ties together, right? You're dealing with the important things in life, and then one therapy becomes the means, not the goal, but the means for something else. And so, and I gave that a name. It's called a community reinforcement method of alcoholism. It doesn't compete with the AA, but nothing does. No professional treatment does. There are some pharmacological methods of dealing with alcoholism. I've done studies in which I've combined this procedure with the pharmacological, antabuse is the name of it, and they work together. They enhance each other. But the point is, here's a whole different method, right? Why isn't it done by everybody? Well, because Marx market. It's cheaper to go to AA. They don't charge anything. They meet over at the YMCA or the YWCA or at the local Veterans Club. They don't charge. And so almost every hospital that has an alcohol treatment unit also has the AA people coming in. You can't fight them. They are all pervasive. And what is the evidence? Zero. What's that got to do with it, right? There are a number of disciplines that don't have any. Okay, well, here, we're going to start the next one here. Don't go away. Addiction. And there are things like alcoholism is legal, semi-legal at least. But then you have the hard drugs, right? You got cocaine and marijuana and THC, and then you have the soft drugs, primarily marijuana. And either way, depending on the state you live in, certainly at the time that I was doing it, and certainly now even, it's illegal. People go to jail for it. Most of the, 50% of the people in prison are there on drug-related charges. So talk about problems that are societal. We're not just dealing with the hiccups here, with the profoundly retarded. We're dealing with the pervasive problems, right? With marriage, with jobs, with alcoholism, with addiction. What can we do there? Well, again, the problem of addiction, you look at it, why do people take drugs? Really, you get the high of your life. It's wonderful, I get high. Nothing else in my life will contribute to it. And the procedures that were developed. So that's the state of knowledge. And what do you do about it? It's declared illegal. We pretend that nobody does it, but then we find out that even President Clinton, he inhaled when he was in college. I didn't inhale, right? I puffed, but I didn't. Nobody can prove I swallowed it, right? And so first, everybody is doing it. The statistics on the number of people who inhale, people who use illegal drugs, it's the majority of the people. Well, so it's widely practiced. It certainly used to be the case. You go to a party and they hand around the joint, and if you didn't take the joint, there's something wrong with you, trying to be the only sober person at the drunken party. And so, so the social influences on you. All of your friends do it. You don't associate with them if you don't have a drag. You don't shoot yourself up. And it certainly gives you instantaneous pleasure. And then what you have is you have the addiction personality. And what addiction? Their addiction personality. The drugs, they have their own reinforcers. You can blame it on some personality problem. So how do you look at it? It's very similar to what we looked at with the alcohol. There are strong reinforcers there. Why doesn't everybody do it? And they would. And in some cultures they do. With the soft drugs at least, opium and others. They are the rule, that people do it. And the answer to that was very similar as it was in alcohol. Who are the people you associated with? What are the conditions of availability? What are the alternatives to that? And building in alternative behaviors, things that have an inherent timeout. We're back to the beginning. Because you can't go visit your in-laws and have alcohol on your breath, right? You can't come home, you can't go to your work with alcohol on your breath or with drugs. So there are things that have inherent timeouts, and that is build alternative reinforcers, alternative activity. And so that runs through the thing now. You don't have to arrange timeouts, you don't have to arrange physical punishment or punishment of any sort. You can use alternative activities that are defined as specially selected as have inherently a timeout from we have a timeout from the use of the drug. Okay, let's see, next. Mental hospital patients. At the time that I started out in the field, mental hospitals had just finished being in a very high state of residency. That there were, okay, I'm going to hit the start button to time in. Mental hospitals, some of them were 40,000 in the hospital. In Illinois, 40,000. New York, 40,000. Mental hospital with 40,000 residents. They were a major drain on state budgets. Anyhow, I was hired right out of, I was just getting out of the Army, and my first job was in a mental hospital, a very small state hospital. And took me on a tour of the wards, and I looked at one ward there that looked like a potential place to possibly do something, and people are just sitting around. Well, I don't know, I read the books about mental illness, supposed to have delusions and obsessions, supposed to talk about things, and pretend that they are Jesus or Mary or somebody, megalomaniacs. Can't be any of that. Just have people doing nothing. They'd be standing, maybe a TV set that didn't work. We had TV then, but it didn't work, and they'd be just staring. They weren't doing anything. So what do? I'm going to work on obsessions and delusions? And why did I start working there? When I was in a mental hospital. They hired me as a research psychologist. I was going to work on animals, but they had mental patients there, and so I saw the people there. So again, it was an accident. They were there. But I couldn't help but see what a terrible state that was. What was the state? It wasn't they had psychotic behavior, which is what you'd think. They had no behavior. They had nothing. Instead of talk to them and give them, look at the existing procedure, talk to them and give them sympathy and understanding so they come over and walked up to one of them. He had a little circle around his forehead where he had a lobotomy, and asked him to say, well, would you like to talk? And he looked at me and just spat a mouthful of spit in my face. His textbooks didn't say anything about that. They said you should carry Kleenex with you. So the academics, it said nothing. And in terms of studies that were done that showed how you cured psychosis, that was considered permanent. You wouldn't even receive reimbursement for it under the DSM scale of medical insurance because it was incurable. You're psychotic, you're psychotic. So what do you do? Well, the objective here was, and this is probably one of the most exciting things, and that is, I'm going to create a new world. That sounds like a megalomaniac. I'm going to create a society that is built on reinforcement principles. That's going to bring out the maximum productivity of people. The maximum, thank you. Some emotion, I should get back to the mic. The maximum productivity of people, the maximum happiness, the least expense. How do you go, what could I do? Because I saw this as a miniature culture. And Skinner had written books on, he wrote a book called Walden 2, but there were no contingencies in it. It was just people were very happy. But why were they happy? I don't know. There was somewhere or other, he just built it in that way, that they were happy with a smile on their face. So I want to build it in. So what I want them to do, I want to get them doing things productive. Well, you're in a hospital. Everything's being done for them. There's nothing for them to do. They're escorted to the toilet, if they can't eat, they're fed, they're called as to when to eat, they're dressed, they're showered, they're shaved, they're hairdressed, everything is done for them. What is there to do? Bold insight. Is there anybody on the ward there that's doing something? Yes, there are some people there who just haven't got enough time on their hands. They're worked to death. They're called employees. And they're running all over the place, taking care of one person or another and answering the phone and keeping records and helping people out when patients want to talk to them. And they're working. Well, why not have the patients do it? There's plenty of work to be done. And so I solved that problem of what work to be done. Have them do everything. They serve the food, they clean up afterward, they clean up around the grounds. I even hired one of them as a part-time secretary. Other psychologists there, hired assistants. Of course, you run into a problem, and that is the labor unions. But if you have your patients do it, they don't have jobs. That turned out not to be a problem. It was a simple solution, and that is make them their assistant. And what do you do when somebody appoints you in your job as an assistant? They do all the work. You sign off. They do all the work. And so it's on-the-job training. And what about if you don't have jobs where we work out all kinds of minor rules, like nobody could work on the same job for more than 2 months, or 1 month, I forget what it was, and then they have to work on something else. So that way, and what about, is this for the good of the patient? Is this no better than indentured servitude? They're here for mental treatment and you're using them in the negative sense of the word used. We're teaching them constructive skills to take care of themselves and to help others and to present themselves to the outside. Well, so, okay, that's the response end of it. And that has an analog. Like we've got children, parents, youth problems. And they come in and they're showing a problem. One of the standard procedures, well, we want to forget about what they're doing wrong. What can they do that's right? Well, I don't know. Well, like we want you to record. So I haven't got time to record. What do you mean? You haven't got time? What are you doing? Well, I got to answer the phone. I got to shop. I got to run errands. I got to clean up. Have them do it. Have them do it. Why? You make the bed? Why? He's 3 years old. He can reach up there. He can reach through. He can do it. And have them do constructive things. And they'll feel part of the family, and it's really family enterprise. And now you're going to have time to do the things you want in life. So this thing got generalized, and that is look around. When you have a situation, you're looking at the token economy, what to do. What is it that other people, what are the parents doing, or what are the employers doing, what are other people doing? What about the reinforcers? What do you do for reinforcers? What are you going to do? You're going to go and give them an M&M every time that they do something right? And the general rule there was, you want them to have everything in life that they want, all their values. What do they want in life, and schedule them as reinforcers. If what they want is a discharge, great. Then you set up a requirement. After they've gotten so much, they've done so much functional behaviors and they're ready to leave, then they've earned an opportunity to go to have an interview with the social worker about getting placement. And so everything is possible. And in terms of children, applying this to the home with parent-youth problems, yeah, you want to go on a trip to Europe after when you graduate, or you want a driver's license, or you want to pay for your insurance, you want to go off to camp, you want people over your house. The tangibles are a very small part of it. The most important things in life are three. And just making especially with young children, undivided attention to your parents for 10 minutes. That's a fantastic reinforcer. So, those are the reinforcers, and that's what I arranged in this one. Where did you sleep? That was a big reinforcer, right? Because they were preferred places where they'd be safe from other people molesting them at night. And who goes in first to eat? That's a reinforcer. Who gets that chair, that comfortable chair? Right? And so all of these reinforcers are available, and they're not tangible, and then they don't have people or the opportunity to do things. But schedule them. And how do you schedule them? Well, you say have them keep a record. Well, many of them, they're not articulate. They don't know how to add. They don't know numbers, right? They've had brain surgery. So that's why we use tokens. It's a tangible. It's the equivalent of coins, right? Except they didn't have any monetary value. So they had points, and so somebody came around and looked at the thing and said, "Oh, this is a token economy." Then they call it a token economy. Well, I learned a long time ago, if you can't fight them, join them. So I started calling it the token economy too. But that's what it is. And as I said, the most important thing I think I'm doing, this is creating a society. All the things in life are yours. And the same thing now with regard to your children and your husband and your work. All the reinforcers in the world, people don't just work for money. There are other things that are reinforcers for them. And so you schedule those things. And along those lines, a humorous incident, at one point there we had a new chair of the department, and he had a degree in business administration, and he was hired partly because of that, because he really had a good sense of finances and business administration. And he instituted a new system. He said, now we've got a new system here, and that is he gets allocated 5% a year for raises, and he's been allocated in terms of people's productivity. And how do you measure productivity? Well, you get so many points for publications, for books, for number of students, number of classes you teach, for number of continuing education. And you get all these points, and then depending on the number of points you had, that'll determine whether you will get the raise and also whether you'll get paid for going to conventions. And when he said that, I thought that was so ironic. I said, that's a token economy. He said, well, I learned it in business school, MBA. I said, yeah, that's where they got it from, token economy. And so it came full circle, right? Now I was at the receiving end, and pleasurably so. I was delighted that I was writing more books and more journal articles and had more students. So that was wonderful, and at last somebody appreciated me. So, that's the token economy. And now, how widely is that used? Everywhere. And every hospital in South Florida that I know of the practicum students, if they have young adults in their program, token economy is a must. Unfortunately, many of these, they take pride in taking tokens away rather than giving tokens. And that was, they see it as but that's another thing altogether. Again, widespread, and in terms of the home, if you have conduct disorder in the home or ADD, ADD conduct disorder, then if you have a problem, token economy, everybody will be happy. You'll be happy, they'll be happy, and you'll get what they want. So, very widespread use. Okay, addiction, what did we say? Mental hospital. Oh, toilet training the normal. Well, that's undoubtedly the area that has received the most extensive application. That book is still in print. There's toilet training in less than a day is the name of the pocketbook. And at the time, what was the state of knowledge at the time? Don't. It's almost like you were a Republican. Don't. Whatever you had in mind, don't. No. Monosyllabic, no. And if a spark said no, you don't do it, right? Everybody learns to toilet themselves. There's no reason to go into use any special program and coerce them into doing it. And the psychoanalysts, the analytic end, said not only don't because it's a waste of time that you grow out of it, but you will create a neurosis. That there's various stages of development, there's the oral, the anal, and the genital. The anal referring to both getting rid of the waste products. And if you go and you have forced toilet training, then they will be caught frozen at the anal stage. They will not develop to the mature genital stage. And so you had active, not only was, and so you had the foremost medical authority saying don't, because it's a waste of time, and they'll learn it anyhow, and you have the other one saying don't, because you'll create a neurosis. Well, so the track I took on the toilet training came really from the work on the retarded. That is, I told you before about training the untrainable, and one of the things was the profoundly retarded. And I succeeded in developing a method that, on average, took 3 days, just 3 days, and they were toileting themselves, not when prompted. Went themselves when they had to. And the business manager of the hospital, I didn't get the stop button. Okay, I'll take advantage of that. The business manager of the article said he's having great difficulty, his wife's having great difficulty in toilet training their latest child. And with all with the luck that I had with the profoundly retarded, what suggestions could I give her about training their child? And so I wasn't interested in her training her so much. But anyhow, that was the accident that got me to work on toilet training. It wasn't because in the inherent interest. And so I went back to the drawing board and said, okay, train normal children. And that turned out to be wonderful. Because with the retarded, they couldn't talk. They couldn't imagine. You couldn't ask them questions. And here were children. They were about 2.5, 3 years of age. Their first word was at the age of 9 months. They could talk, and they could understand. It was wonderful. And here I was working with the retarded, and I got them in 3 days. So what I did is I went and I developed a procedure based very much on language, very much on feeling and on their emotion. We never asked them, do you want to be toilet trained? Because they would all say no. I'd ask them, do you want to go to school? And you really put their words for it. They said no. And things are very comfortable at home. Why do I want to go to school? And so we said, we're going to play a game. Anyhow, I made a list. And this was a real fun part, and I wonder why I never used that with any of the others. I made a list. What do we know about the learning process? What are the facts of learning? And I made a list of them. And one of them is to go and to use several different reinforcers, and in that way you don't have satiation of any one of them. And in the initial stages of acquisition, CRF, continuous reinforcement. You reinforce every response, shaping, then the minuscule response first, the one that they already have, and then you build up on it. So I made a list of all of these things, and then in terms of maintenance, jumping ahead, what you do is you want it to be maintained. So now you enlist the environment. So I enlisted the uncles, the fathers, the visitors, any adult member, enlisted them in the program as well. And also, what you didn't want them to do is to just train them to go to the toilet. Otherwise, it's like experimental production of diarrhea. You don't want people running to the toilet all the time. What you wanted them to do is to avoid the wedding. And so what we did is a whole different procedure on that, and I'll tell you about that. That really was a different thing, that overcorrection procedure that I accidentally discovered. So I developed that procedure, and it was from that was a whole different approach. I made a list of the things that are important in learning, the facts, and made a list of them, and how can I put them together so that it's a game. And that was one thing. It has to be entertaining. We're going to play a game. I don't want to be toilet trained. Good. We're going to play a game. We're going to teach this doll to be toilet trained. She doesn't want to be toilet trained either. And we're going to play a game. And that was another principle I used, one that never was in any of the books, and that was that you learn by teaching. I never read that anywhere, but it did seem like it made sense. But in general, my philosophy was don't do anything that's gimmicky. It's got to follow conceptually from some general principle of behavioral psychology or some other principle. So I did that, and I did a controlled outcome study on it. And again, in terms of the literature, I looked at the literature. There hadn't been any study. Nobody had ever done a study. And everybody had the right idea on how you toilet train. And they'll tell you how they toilet train their kids. And you ask them how long did it take you to toilet train. Some people said 5 minutes. They never wet their pants once, because from the day they were born, I put them on the there's a belt that's provided by the manufacturers so that they don't fall. And they never wet. So you can't trust that data. But no studies. Incredible. Just like these other areas. It's just unbelievable. No studies have been done, and yet they give you advice. When I wrote the book on that, I presented to a publisher, and he laughed and said, "What do you mean a book? Am I interested?" No, he said, "You mean a page? A pamphlet? You could mean a book." and so that was that. But this other publisher was really much more knowledgeable and foresighted about it. And that turned out Simon & Schuster, and they're the largest publisher in the country, and they paid me an extraordinarily high advance, which was marvelous. And I often joke to my children that they went to all these nice private schools on a stream of urine. The royalties from that was just wonderful, and it sold something like 3 million copies, and it's been translated in every language that there is. And at the time I wrote it, there was nothing that was written on it. Nobody did none any studies, even control studies. But then, for some reason, somebody told me that there was a lecture that was being given at their university on toilet training by a pediatrician. He gave me the name of the book and asked me to look it up to see if I knew anything about it. I looked it up. It was published by. It was listed in Amazon. And so I went to Amazon, and not knowing that much about computers and all, I listed any book that has a title toilet training in it. And 150. I let an avalanche loose. it was, and then nobody had done any study on it. Nobody had written any book on it. And now every book that's written on it, I know when I go to a bookstore, I see if they're carrying the book, and they're very kind. They say, "No, we don't have any. We must be out of stock." But we'll order it for you. And they have other books there, and I look through the back of the book. That's where the index is, to see what references they have, to see are there any studies that have been published. I haven't had the time to go and do a literature survey. And no, they say it on their intuition. It's unbelievable. And they keep publishing on it, and publishers keep publishing it. And it's just disgraceful. And as you saw, that's over and over again. All of the marital counseling, the job finding, the retaliation, the alcohol, the area of ignorance is just enormous. I had myself a ball during my professional life. It was just wonderful. I couldn't wait to go to work. I hated to leave. I couldn't understand why the other people would leave at the end of the day. I mean, all these things to be discovered, all these things to be developed, and that the behavioral type of point of view is the most dynamic, the most all-encompassing, the most fruitful kind of conceptual scheme that you could have. It dealt not only, as the name implied, behavioral, what they're talking about is functional. That's what the behavioral means. They're teaching their functioning to be better. But the positive thoughts go along automatically with the positive function. Well, so that toilet training, that turned out to be very, very popular. Well, let's see, what's next on my mental hospital paper? Well, I guess I covered that already. And that goes along with the token economy. That is, use the token, if you have a group setting, you're using the token economy. So that was very good. So I gained 3 minutes on that one. The next one was toilet training normal. Well, I keep digressing and going on to others, so I covered that already. Boy, I'm ahead of the game here. And uresis. there's only one procedure when I was a graduate student, and it tells you about the dearth of knowledge of any kind of validated treatment procedure. There was one. And that was the one developed by Hobart Maurer. It's alternatively known as the pad and buzzer method. It's to deal with enuresis, the bedwetting. And what he did is he developed this procedure. He invented this gadget. There was a pad, it had wires running through it. If you moistened it, if you poured water on it, now current could flow from one wire to the other, and that would allow a relay to go off and sound a buzzer. And he explained it by classical conditioning, which I think was a mistake, but it worked. And he did it. How did he happen to do it? To give you the personal flavor of it, he and his wife were house parents of a home for developmentally disabled. And the most impressive thing about the home was when you first arrived, it smelled. It smelled so awful because everyone there wet their bed. There was no cure for enuresis. And so he was a student of a learning theorist, and he developed this, he invented this gadget, and he wrote the most scholarly article I've ever read in any field. Traced it, he did a review of the literature going back to prehistoric times, I think, on what the past practices were in different cultures and what the medical practices were, what the current practices were. He talked about the psychoanalytic view, which said, of course, that you shouldn't do it, that you'd be making the person neurotic. They invented a term called symptom substitution, that behavioral people would get rid of a symptom, but then you haven't gotten rid of the underlying problem, which is it's a disordered child, he's neurotic, and so you'll have symptom substitution, another symptom will occur in its place. Well, he did a beautiful article on it, and he did something that in his journal that almost no other developer of procedure ever does, and that is he dug up somebody who actually had invented that particular gadget beforehand. He was a German, and he had developed it for a different reason, and that is that he worked on a ward, as Hobart Maurer did, in which there's a large number of these anuretic children. And the important thing was that they developed rashes, the patients developed rashes, so he wanted the staff to change them, to change their clothing, so that they wouldn't develop the rash. And so he developed this gadget as a way of alerting the attendants to come and change the person. But after he developed it, he found out they didn't wet anymore. He said, wow, it wasn't just alerting the attendants to do it, it eliminated the problem. Well, so when I had a population of retarded individuals to work with, as I explained before, when they replaced the mentally ill, then I said, well, that's simple, I'll use Maurer's procedure. And that recalled to me a conversation that I had with a graduate student at Harvard. So a graduate student said if he ever went into the applied area, that the one problem area that he wouldn't bother studying, because it was the only one that had really been solved, was enuresis, nocturnal enuresis. And here I was, I jumped into it. I tried it, and it didn't work. They slept right through it. Well, these people were much more retarded, profoundly retarded than Maurers were, apparently. It didn't work. So that's what got me into that area. That it was purely accident. I just tried something that was supposed to work, and it didn't. What were the alternatives? There weren't any other alternatives. That was the only procedure. And that procedure of Maurer's had been replicated dozens of times. It worked beautifully. But it didn't work with the retarded. So I had to develop a different procedure. And so I developed a totally different procedure, specifically with the retarded, that didn't depend solely on that gadget. And what it did is it taught them to become sensitive to when they wet, and to call the alternative response. It taught them how to go to the toilet when they had to go, and it told them how to retain the urine in their bladder for longer periods of time. And it worked. So now, even the most untrainable of the retarded, they were trained. And the next step was the same as the one I mentioned before about the daytime training. That someone said, if that works so well for the daytime sort of training, what about nobles? How about applying it to them? So I did. I applied it to them, and I did studies comparing it with the gadget, and it was comparable in effectiveness, and marvelously. They were not incompatible with each other. You could use the method I developed and still use the gadget at the same time, which made it even more effective. And so there is an alternative. And there have been studies that have been done by the medical profession. They have some drugs that will help with the enuresis problem. None of them are as effective in the studies that have been done. None of them are as effective as the gadget. None of them are as effective as the other method that I developed on that. But that hasn't been used as much as the one for the daytime training. Why? Because there is this alternative, the gadget. But there are many people who don't like the idea of having something electrical in the same bed as their loved child. And so that's why I developed it for young children. Because when I start suggesting that to parents, they say, they never would allow a battery electrical or something electrical in the bed with their child. So that was the accident that led myself to it. And so what they did, what was the central feature of that procedure, was to teach them the alternatives, to teach them to be sensitive to the feeling of wetness, to get up out of their bed and go to the bathroom on their own, and had the parents checking on their bed during the first 2 nights. They checked every hour, and in that way they could give them feedback without the gadget. Okay. Next, enuresis, medical. Yeah, medical brain injury. There's some types of disorder that you see in the mental hospital, and this is one of them where the person is obviously suffering from that problem because of neurological medical problem. It doesn't seem like a psychological problem at all. You know, the one case that was prototype for that was this a young woman who screamed loudly. And screamed so loudly and so continuously that even though it was a very large acreage mental hospital, you could hear her, even though the doors of her ward were closed, you could hear her outside of the hospital, shrieking, screaming. What was wrong? Well, it was pretty clear. She had severe brain injury, and you could read the operations that were done. She had some damage done to her brain, and she had there was some parts of it that were extirpated and were removed. So there's no question that this was something that was in medical knowledge. She wasn't doing it for attention. She wasn't doing it like a normal child learning to toilet train. That she simply wasn't developed enough. Okay, so that was the accident. It just happened to be one patient like that. State of knowledge about what to do, it said you don't. That's a purely a medical problem. No psychologist would trust it, no behavioral psychologist would trust it, right? And yet, that's too dumb to know better. As far as I'm concerned, behavioral psychology, it arms you with its objectivity and its precision and its emphasis on efficacy and the data. So I tried that out, and I used basically the basic principle we're shaping. What is the alternative to screaming? Being silent. Okay. And silent also while doing something enjoyable. If you're with somebody and you're doing something enjoyable, you don't scream. So I did this part myself. I did this in something I assigned attendance. I knew the patient was lying in bed. She was screaming her mouth, screaming as loud as she could. But inevitably, it works out the dynamics of screaming are that you can only scream when you're exhaling. Oh, I'm getting some. Oh, 3 minutes. Okay, that's the last topic. Okay, so the talk will end with a shout. So anyway, she's lying in bed. I went over here and I did you say, Anna, here, and she inhaled, have to inhale in order to scream. You're quiet, wonderful. Here, let's get up and walk around. And just raised her, and her feet barely hit the ground. Oop, you're back again. She started screaming. And we did that. And that's the thing. Always start with the minimum amount of behavior. Even if it's just the time it takes to inhale. It's a fraction of a second. And we gradually built up that duration until finally she was remaining silent. And we walked around and had her go around with another patient and with a friend and talk to her while we were going, you're screaming. We've got to go back to bed so you can rest. And that was it. And she ended up being free of screaming. And I published that. And many people who work in medical schools tell me that had the greatest impact on their profession of any article that was ever published. That there were so many problems that they said, you can't work on that, that's a medical problem. They said, but Azrin did it. And they know it was brain injury because it was an operation. They took the brain apart. Summing it all up, Behavior analysis and behavioral psychology, as I'm reiterating, is the most dynamic, the all-encompassing frame of reference. It handles everything from finding a job to drug addiction to getting rid of tics. I didn't talk about that. Tourette. If you know anybody who's got Tourette, tell them to go to a behavior analyst and look up Azrin. Look at Google under Azrin and Tourette. It can cover everything. It's a whole way of looking at things. It isn't just, and is it just giving a reinforcement? No, not at all. It takes advantage of intrinsic reinforcement. It gives supplemental things that you take and it gives rewarding. It deals with the people's highest levels of aspirations, their values, their goals in life. It does everything for them, at home, at work, with their friends, everything. Well, as of exactly 1 month ago to the day, I said I'd make this a highly personal presentation. I resigned officially from my position as professor at Nova University. And you can't help when you resign or you stop some activity to look back at what you've done. And I look back just with great pride and pleasure. and some people say, yeah, but many people don't know. They don't know you invented the timeout or the token economy or you have it universal. That's all right. I passed that stage. When I was when I was doing lab research, I looked at the articles and then see if my name was cited. I don't care if they cite my name. The greatest flattery that they can give me is to use the procedure. And they don't even have to use the same word, just like my chairman used it on me, and I used it. And so it's the greatest of all to say. So I envy you. You have all that ahead of you, right? Think big. Think big. And you think, well, there are no other problems to solve. Everything. Everything is there. And think big. And you're in an academic setting. You may or may not be in an applied area. And your field may be strictly that of the behavior analyst and certified or whatever. But the world is everything there. I started the first master's program in behavior analysis at Southern Illinois. It's still in existence now. I was the first president of almost every behavioral organization. And that is, think big. The world is just waiting for young people like you, and if somebody bereft of that intellectual endowment as myself can accomplish that much, just think of what you can do. I thank you for your time.
For those of you who have come for CEUs, please go back into the check-in table, and as you check out, we will be giving you your CEU certificate. So thank you again.